dinner, awards dinner session, we actually have a very important symbol of what the Global Health Catalyst Summits are about. We are really funded by NIH to create collaborations. And today, over the past months, or actually a year, last time at Johns Hopkins, we initiated the pathway to creating a collaboration between the University of Jordan and the Global Health Catalyst and the partner institutions involved. And so today, we will have a symbolic signing of a memorandum of understanding, and we are very happy and honored that we have the president of the University of Jordan with us, and the dean, and also the faculty as well, with Laila, who has been spearheading the initiative, and Salameh, who is one of the catalysts from. Great example of the diaspora helping catalyze collaborations. Let's first give an appreciation to them, please. And so what you're going to witness now is really a historic moment where we really are going to kick off these collaborations. You may have seen earlier this morning, if you were not in the session, they did list some of the areas where they would like to see collaborations. And we actually have identified some quick wins so that next year, when we have the GHC Summit, we're going to be reporting outcomes, what has happened since this collaboration was signed. So we're going to start to do the signing ceremony, and then we're going to welcome the President, Dr. Nathir Obeidat.
Got it quick.
Thank you.
Yes. Yeah. Thank you. I think it's an important opportunity for us at the University of Jordan to collaborate with the Global Health Catalyst and the institutions who are part of this organization. And I'm sure that this will help Jordanians, will help poor Jordanians and rich Jordanians. So everyone in Jordan will win from this thing, the MOU, and hope one day this will be an agreement to have a specific thing to do. And today I learned a lot that education, training, and research is one thing. So research will affect education and training, and education also will affect research. So I'm sure the future will be better for us, for University of Jordan, after this signing this MOU. I would like to thank you for helping University of Jordan, helping Jordan in this regard, and wish you all the best, and wish to the participants all the best, and thank you for supporting us and supporting University of Jordan. Thank you.
So one of the things that we have actually agreed, very small, quick wins, is that we're going to do a GHC Jordan, right? So we're going to bring all the stakeholders. All of you will be invited to visit Jordan, and I'm sure they'll be very happy to host you.
Because of that, I invite GHC to have their next or one of the conferences, and I hope soon, in Jordan, and specifically in the Dead Sea, which is a unique place, which is the lowest point at Earth. So this is something we have to consider.
Absolutely.
You have to consider that.
Thank you, sure.
So I promise I'll make it short, but it's a moment that I'm filled with emotion, so I have to speak it out. I want to just emphasize on how, as well said, historical. It's a major milestone in my career, because when I started this, I was a trainee coming from overseas, and I was struggling to prove myself as a clinical fellow back in very competitive environment in Boston. And then I realized that there is an opportunity here. So by attending one of the summits and reaching out to Will, I appreciate how humble, how easy to approach Will is. And it was me, my partner, Lubna Hamoudi, who was a fellow at the same time. So we are a dreamer, and we have a vision. And we're always thinking about how to pay back to our country. But sometimes we don't have the resources or the access to do that. So I appreciate that through the Global Health Catalyst, we had the chance to have something to present to our leaders back home, and to show them that even it's a little thing, but it can grow. It's like a little seed that can grow more and more. I'm so appreciated to the support that we got from the leadership in the University of Jordan, and by being here with us, that can tell how much they are involved, they are invested in the future for our healthcare back home, and how much we are open for more and more collaboration. And I think the easy part done. Now we have to start implement and have something in place. So thank you, everyone. Thank you.